So welcome everybody. Thanks very much for joining us for today's webinar. In the spirit of reconciliation, we acknowledge the traditional custodians of country throughout Australia and their connections to land, sea and community. We pay our respects to the elders past and present and extend that respect to all Aboriginal and Torres Strait Islanders. If we've never met before, my name is Nell Thompson and I'm the Secretary of the Australian Institute of Animal Management. I'll be hosting and co-delivering the webinar. Sorry, my automatic lights are going off. The webinar for you today. And I've been on the AIM committee since 2013, and I'm also the coordinator of the National Getting to Zero program. The Australian Institute of Animal Management, or as we call it, AIM, is the national peak body representing local government animal management officers. The AIM committee consists of a wide range of professionals engaged in the various aspects of animal management. AIM seeks to support those engaged in the business of animal management and the function itself by providing training and information, opportunities for networking and collaboration, and by encouraging the use of best practice, policy and practices. AIM understands the significant pressures placed on local government and related sector service providers when working in the companion animal management space. We welcome new members and people can join via our website at aim.org.au. So to our presentation for today, there'll be around 45 minutes of presentation and about 10 minutes of question time once the presentation has concluded. The recording of this webinar will be accessible via our website to all members to watch at any time. We're going to ask that everyone mutes themselves during the presentation, and if you have questions, you can start putting them in the Q&A section and we'll get through as many as we can at the end of the session. If you've got quick questions that relate to your understanding of the content, put your hand up. There's a button down the bottom that you'll see there, and we're happy to answer them during the presentation. If you have more questions or we don't get to yours during the question time, you can send us a Facebook message or an email and we'll get to you that way. As always, please excuse any working from home or background noises. And I'm very pleased to introduce Emeritus Professor Jackie Rand as our presenter today. Jackie graduated with a Bachelor of Veterinary Science from Melbourne University in 1975 and worked in veterinary practice for 8 years before doing a residency and doctorate at the Ontario Veterinary College in Canada, followed by 3 years as a senior registrar at the University of Zurich in Switzerland. She's a registered specialist in small animal internal medicine and a diplomat of the American College of Veterinary Medicine, and was appointed Professor of Companion Animal Health at UQ in 2001. And then she retired in 2015 to head the Australian Pet Welfare Foundation, which is dedicated to saving pets' lives through research, education and advocacy. She's published over 112 journal articles, authored 42 book chapters and is editor on 3 books. Currently, she's involved in research programs in shelter medicine aimed at preventing unwanted and problem pets, as well as ongoing research in diabetes and obesity. So let's get started. Over to you, Jackie.
Thank you very much, Nell. And I'm delighted to be here. And so what I'd like to talk to you today about is contemporary urban cat management. And I know you're working in a very challenging environment. And I think some of the things that we've got to talk to you about today, which is from our current research, will really help. But before I go further, I wanted to be very clear about the definitions of cats and the definitions that you should be using, because it will determine how you manage those cats. So feral cats are those that get no support, food or support from humans. And of course, as an animal management officer, when you've just trapped a cat, you don't know what it's just eaten. But feral cats are typically more than 2 to 3 kilometres from the nearest habitation. If the cat's been trapped in response to a complaint from humans, then it's a domestic cat. And it'll either be an owned cat if it's not identified, an owned unidentified cat, or a semi-owned cat, which is one that's getting fed by someone who doesn't perceive they're the owner. And they're typically stray cats that have adopted the person. Or unowned, which is a cat that is getting unintentionally fed, like from food from garbage bins. And in our research, unowned cats are extremely rare. Virtually every cat that we have been involved in desexing has either been an owned cat or a semi-owned cat. And so these cats are in peri-urban areas. They're the source of the complaints, and they're also around farm buildings. And why it's so important is that, when urban strays are considered feral, it means that they're then subject to invasive species legislation, that landowners have a duty to remove them, and they can be shot, they can be poisoned, and they can be leg hole trapped. And this is actually in Brisbane, not in CBD, but where they were using leg hole traps for domestic cats that were being fed by people. And I know when you're faced with a complaint, it's very easy not to recognise that there's likely a person behind that cat and feeding that cat and emotionally attached to that cat. And I just wanted to run past you some of the quotes from people who have been feeding cats in multi-cat situations. I don't like to call them colonies, but this is the sort of comments that these people who feed these cats say. They're sort of like become your own cats. Even though there was 100, there were still very special ones. They're basically the same as a pet cat that you'd have at home. They have names, they have personalities, and they have their little traits that each individually have. The bonds that we have with them are just as strong as the bonds as my own cats that live in my house. We think of them as our own cats. And if you can harness those people to solve the complaints and to manage them in a scientific way, which will reduce the numbers and reduce the complaints, that's the best outcome. But in fact, what happens, and this is, you've probably, some of you have heard of the Stockton break wall, where in fact, and this is the break wall where people walk with their dogs and their kids and kids on bicycles. And apparently a cat ran across the break wall and a kid fell off its bicycle. And so they engaged a licensed and experienced external contractor because they deemed those cats to be feral. And what happened was that the cat carers came in the next morning and saw these trails of blood. There were cats that were still alive but had been shot, some that had been shot through the head. And the important thing is to realise the impact on those people. And these are some of the quotes. I couldn't eat for weeks. And these quotes were got nearly a year after that incident. So you can see that the effect is quite long lasting. I'm that thin, and it's because when the stress of the cold happened, I literally couldn't eat. Horrific. Months and months, and still today, of horrific nightmares. Nightmares about cats being injured and jumping into the water, and me trying to get into the water to find them, and I can't. Just that repeated nightmare because I couldn't help them, and I felt so helpless. And we just felt absolutely grief-stricken. I cried like I'd lost all of my pets, my whole life, 1,000,000 times over, because I didn't know exactly who had gone and who was left injured. And this was a memorial a year later. So you can see that some of these people have actually got post-traumatic stress. And in solving these cat problems, there's always people behind them. And you have to work with them to get a solution. But I think, we'd all agree that there's, we'd be better off with fewer free-living cats in our cities, fighting, soiling on people's property, having kittens, predating wildlife, wandering into areas they shouldn't have, and costing local governments and shelters money. The question is, how do we get there? So it's really important to know how big the problem is and know your data. And this is some most recent data from Diana Chu. She's doing an MPhil, and we have surveyed all the states requesting data, and this is our best estimates. And so You can see the number of cats coming in per 1,000 residents, 4, 7, 7, 10.5, which really reflects how local governments manage cats. And in Queensland and Victoria, typically most local governments will either actively trap and or provide trap cages for people who found a cat or are complaining about a nuisance cat to trap them. New South Wales, a lot of the councils don't do anything, and the cats just are taken to the local welfare agency if a rescue group can't take them. You can see that the return to owner rate is different, and New South Wales is actually 3.8, so it's a little bit less. So it's nearly half of what Victoria and Queensland, and there's some issues in New South Wales about why that is so, and they're actually at the moment doing a review to try and make microchipping more effective. Return to or rehomed does vary between states, with leaving an overall euthanasia rate ranging from 21% in Queensland, and that's because the Animal Welfare League and the Queensland RSPCA have very low euthanasia rates. Whereas in New South Wales, it's going up to 39%. But it has come down on an average in the last 6 years of about an average of 48 to 50%. So it is coming down slowly. And some of you might have been involved in killing healthy cats and kittens. And this is a kitten being killed, being injected into the abdomen with lethobarb. And they don't just lie quietly in your hand. They mew and they squirm. And that is incredibly traumatizing for the people working in shelters who are faced with killing those cats. In fact, some animal management officers taking them into a shelter that they know is overwhelmed with newborn kittens and pre-weaned kittens, and that they just can't take anymore and have to euthanize them. And recognising the problem for what it is, most cats coming into shelters and or being impounded are healthy, most are stray, that is they're not identified, and most are less than 6 months of age. And what's being killed are mainly pre-weaned kittens because they require a lot of resources, bottle feeding, and timid adults. And if you look at where your complaints are coming from and where your impoundments are coming from, they're from the most socioeconomically disadvantaged suburbs. So it's the disadvantaged households that very often, where they just haven't have the funds to desex their cats or build effective cat-proof fencing for them. So what are we going to do? Well, we can keep doing what we're doing, which is either for some councils doing nothing or providing an impoundment service, accepting strays from the public, and providing traps. And the data shows that we're killing about 5 to 10% of the urban stray cat population annually. So that in a city of 200,000, there's about 4,000 female cats producing an average of 5 kittens a year, which is 20,000 kittens. Now, most of them do die before they're 6 months of age, but the same number or even more kittens survive. So you've got the same number of cats next year, and it's really associated with the population and how many people are feeding them. And data from Australia, one part of that study, they tracked cats in forested areas. Another part of that, they tracked cats around a rubbish tip. And they showed that killing 30% of the cat population in those areas led to a rapid increase in cat numbers. And they had migration of more of juveniles into the area when they removed the more dominant cats, and you get increased survival of juveniles. So essentially, we're sustainably farming cats. We're harvesting the juveniles and leaving sufficient breeding stock there to replace what we're harvesting. And I think you've all heard this quote, insanity is doing the same thing over and over again and expecting different results. And that's what we've been doing for the last 50 years. And if you don't believe that it doesn't work, here's data over a 7-year period from New South Wales, where they impounded into councils 173,000 cats. People had to kill 107,000 of them. Did it make any difference to the intake? No. 24,000 at the start, 24,000. So all those people in shelters and animal management officers being involved with killing these cats and kittens, it made no difference. Now, what has been shown in modelling, what will be effective is high-intensity culling. So that's high-intensity trap, adopt those that you can adopt and kill the rest. But it's only effective if 30 to 50% of the population can be culled every 6 months for at least 10 years. So in that hypothetical city of 200,000, where you've got about 5% of adults feeding an average of 1.5 cats they don't perceive they own, it means you have to trap and remove 4,000 cats a year. And based on a cost of about $250 to $500 to go out, trap the cat, and then euthanize it or hold it for the minimum holding period before euthanizing it, it's going to cost that city of 200,000 people between $1 and $2 million. And you're also going to need to build shelters for the minimum hold period. And the question is, is a city prepared to spend that sort of budget, and will the community support that level of culling? And the telling thing is that there has never been a published paper yet at the suburb or city level documenting this as either occurring or being successful. So it's just not acceptable from a financial point of view and from a community point of view. So we're not left with a lot of options. Banning feeding doesn't work, but desexing, and it's got to be high intensity, free and targeted to locations of highest cat impounds. And for all of those cats in that targeted location, for owned, semi-owned and unowned cats, and we call that a community cat program. In reality, it's going to be mainly owned and semi-owned, and you'll have difficulty finding cats that aren't getting intentionally fed by people. And it's a sustainable solution. It's supported by the community, it's supported by animal welfare groups as well. And so I'd like to present a little bit of information about the Australian Community Cat Program, which is aimed at investigating the effects of a program that's based on desexing for these owned, semi-owned and unowned cats. And it's about looking at a proactive, preventing kittens being born compared to this reactive approach of killing kittens and cats. And we've got sites in 4 areas of Australia now, and the biggest, one with the most research going and has desexed the most cats is in Queensland. And so for those people who are not familiar with Brisbane, I just wanted to show you where we're working with this project. Brisbane's right, part of it's on the coast, but it sprawls west. And then the city of Ipswich, which has about 220,000 people. Part of Ipswich is part of this west sprawl of the Brisbane suburbs. And the 2 suburbs that we're working in is Redbank Plains and Goodna, which is just above Redbank Plains, which is part of this urban, highly urbanised sprawl. And the other area that we're working in is Rosewood. And Rosewood is a really fantastic example of a small country town, and right across Australia, small country towns have cat problems, and we can show you how effective it is there. But if you can just sort of appreciate the difference between Rosewood here, surrounded by farmland, and Redbank Plains and Goodna, which are highly urbanised. This is another map. So Rosewood, if you remember that data that I showed you before, where the average was 7 cats per 1,000 residents coming into shelters and pounds in Queensland, similar to Victoria. Rosewood had 25 cats per 1,000 residents when we first looked at the data, and there's a population of under 3,000 people. Goodna and Redbank Plains here, 25 and 21 cats per 1,000 residents, but approximately 10 times bigger than Rosewood, which we started off as a pilot. And we've been going out, we have have these flyers that we drop and we use in Facebook posts, free desexing. We've been very lucky that the cat desexing has been paid for by the Bridget Bardot Foundation. And the vaccination and flea and tick has been provided by MSD Animal Health. And Central Animal Records are providing free registration of the chips. And so this is a little bit from the data in Rosewood. This is the average number of cats coming in. And remember, it's only a small country town of less than 3,000 people, 60 cats, 38, 56. And then we started desexing, and we started desexing in August of 2020, and then increased it right through. And you can see that the average intake over the preceding 3 years was 51 cats per year. We desexed 33 cats per 1,000 residents in the 18 months, nearly 18 months. Well, 12 months from August to June, sorry. And then we've desexed more up until the end of the year. In the first year, so we only had desexed for 5 months there, we showed a 20% decrease in intake and now a 55% decrease in intake based on that average for 3 preceding years. And the effect on euthanasia is more profound, and that's been reported overseas as well, because you're stopping those poorly socialised and those pre-weaned kittens coming in, which are at high risk of euthanasia. So you can see that here they had 29% of intake that was euthanized, only 1 cat in the 2 years euthanized after it started. Now, Red Bank Plains, as I explained to you, is a different area. In Rosewood, there was a Country Women's Association, the town was very connected, and it was much easier to get people to enrol their cats. And in contrast, in Red Bank Plains, we've had many spots not being used for the desexing days. And so we were a little frustrated that you can see the average intake per 6 months was 140 cats per 140 cats. And despite desexing over 400 cats, which is 17 cats per 1,000 residents in this period here in the year, we didn't see a decrease. And so what we changed to was micro-targeting. And that's really the key for you as animal management officers that will be most effective in these areas where the community is not as connected. Red Bank Plains has grown by 25% in population in 5 years, and it's mainly an immigrant population and very varied backgrounds and ethnic groups and languages. But by micro-targeting, just in 6 months, we got a 45% decrease. And this is what micro-targeting's about. So we plotted on a map where the cats were coming in from. So the blue squares own the surrenders, and all the round circles are strays. The darker the red, the more came in from that site. So here you can see in Red Bank Plains, just off Hallett's Road, 6 strays came in. And if you do that, and ideally what works even best, because these are the ones that have come into the shelter impound and have been impounded, what is even more effective is when you get the complaint that you go out with boots on the ground, door knock, because I can guarantee within 3 or 4 houses of where a cat is being, causing a complaint, you will find who owns it or who's feeding it. And you have to also go over the back fence, over the street behind, because it may be in the street behind. But if you door knock and you talk to enough people, you will find even the cats that are living in drains are being fed by someone. And it's to work with them to make them realise that complaints kill cats. You need to get them desexed, you need to get them identified, and to get them on a feeding schedule, and also help them with containing their cat where possible. I just wanted to talk a little bit about semi-owned cats because they are very prevalent in our community and the biggest source of stray cats coming into the shelter and house. So it's people feeding a stray cat they don't perceive they own, and that's depending on across Brisbane, where we balanced it for socioeconomic level, it was 3% of adults. But in the lower socioeconomic areas, so we surveyed those 3 suburbs and it was 7% of adults. So where there's more stray cats, cats are finding people to feed them, and so there'll be more semi-owned cats. Most are feeding 1 to 2 cats on their property. In some of the research we've done, those people say they talk to the cats multiple times a day. 90% agree or strongly agree that the cat helps them through tough times. Now, they may not be able to touch these cats and they may not be able to pick them up, but they still have a connection with them. And they don't, and they will take ownership of them. Generally, if it's 1 to 2 cats provided, they are allowed to have a cat on their property. But you need to, in New South Wales, where registration is a real barrier, need to provide free registration as well. And these people represent a huge pool of potential adopters. You don't want these shy and timid cats coming into the shelter because they'll be healthy, but you're going to have to kill them. But these people will take ownership of them. And they are at such high risk of euthanasia, and it's much cheaper to provide free desexing and registration than to have to take them in and then try and find a home for them. And I just wanted to also talk a little bit about multi-cat sites. And we're defining that as 6 or more cats, and averages, these people have 12 cats that they're caring for. So it's about 1 in 25 semi-owners who are actually overwhelmed individuals that are feeding 6 or more cats. Sometimes the squalor situations, very often I think there are mental health issues and these people are just not coping with life. But they want help and they'll respond very well, provided you don't kill the cats. Luckily, most are on private property, including around social housing, other sites like on aged care facilities and hospitals. But few are on truly public land. So in most cases, they can be desexed legally if a carer has their name on the microchip and the registration documents. True hoarding's rare. We've got 2 rescue hoarders that we're dealing with. They take, and a rescue hoarder is someone who believes that only they can save the cats, and they do get strays from the community. And they take a lot more time to get trust, but once you've got trust from them, then you can work with them, and they generally know where a lot of the problem areas are. An exploitive hoarder is someone who doesn't care at all about the cats. They're very often maybe breeding for profit. They've got dead and dying cats in awful circumstances, and luckily we haven't had to deal with one of those. And the recidivism rate for those is essentially 100%. And these ones, the overwhelmed carers, they're not hoarders. They're just overwhelmed carers. And this is typical of a multi-cat situation. So what you need is plenty of food and plenty of hiding places. And so this was up at Rosewood. There were 23 cats there. We removed the kittens for adoption. Of the 10 cats left, she took ownership of 3. So this middle one's own. This one is, we have a very special permit for restricted matter for research. So this cat's ear tip, it's microchipped, and it's microchipped, it's got our contact details on it, but it says the owner is a Rosewood community cat. And this cat's also, it's got an ear tip here, and it's wearing a tracking collar. This is another multi-cat situation. Again, hiding spots and excess food. There's about, I think, 10 cats on this property. This person very much cared for the cats, and other neighbours did as well. he didn't want to take ownership, so we were able to desex them and leave them with him. One of the cats has subsequently walked up the street and found someone to care for it as an owner, and we've changed the microchip details over to that person because cats are very opportunist. Based on, we've got camera traps, which are motion detecting cameras out, and bait as well as those tracking collars. And so, you know, we can reaffirm what other studies have shown, that this is when cats are most active. This is based on the camera trap data. And you can see this is winter, this is summer, from about 3 o'clock, 4 o'clock in the afternoon through to 9, 10 o'clock in the morning. And in summer, a bit shorter. But it means that most of the wandering, and with the tracking collars, we can show that the most risky behaviours like crossing main roads, travelling the biggest distance, occur at night. And so one of the things that you can help people with is promoting bedtime feeding, to keep the cat inside at night, to reduce complaints and reduce the potential for wildlife predation. And so that's feeding half of the food in the morning. Very important to remove uneaten food after 10 to 15 minutes, both to make it more effective and stop obesity. Then when people are going to bed, close all the doors and windows and feed the other half. So it prevents car accidents. And if you look at what of the threatened species that are most likely killed or most often killed by cats, they're all small nocturnal mammals like the squirrel gliders, some of the small bats. So this is very effective for protecting species of conservation concern and also keeping cats safe. It's of minimal cost. They just need to buy cat litter. And so it is achievable for people, even with a DoorDasher cat on a rental property that has very poor fencing. And we've got some brochures if people are a flyer. If people would like that, I'm happy to provide that to Mel for you to use. And, you know, we all want to stop this roaming and soiling. And what would be most, you know, compelling and most obvious and logical is to stop these own cats leaving their property and mandating 24-hour containment. And then, you know, everyone should be happy, and if just the cat owners will be responsible, we'll solve the problem. Well, in fact, unfortunately, the data doesn't support that. And the issue is these semi-owned cats, and those cats are predating, soiling, fighting, causing problems. And as I said, 3 to 9% of adults feed an average of 1.5 cats they don't perceive they own. It's highest in low socioeconomic areas. 90% say the cat helps them through the tough times, so they've got a relationship with the cat. Most are not desexed. And we talked about, you know, how many kittens are being produced. This is a city of 100,000 here. And in fact, mandated containment is a barrier to adoption for these people to take ownership of these cats, because some of them initially are very shy, but over time they'll become much more socialised, and they can work on at least bedtime feeding, keeping them inside. But the data shows it doesn't work anyway. So this is Yarra Ranges, where they mandated it in 2014. And you can see that although the population changed, had increased by 2% in the following 3 years, but nuisance complaints were still up 3 years later by 143%, and cats impounded was still up 68%. And it doesn't work after 20 years, because this is the Casey Council that implemented it in 1999. And although the population increased by 134% in that 20 years, cats impounded was still up. So it doesn't work in the short time, it doesn't work in the medium term, and it doesn't work in the long term to resolve complaints and decrease cats impounded and decrease cats that have been euthanized. But what does work is target desexing. And this is from the city of Banyule in Victoria, which they have a population of about 130,000 at this time. And the animal management officer, Jenny Cottrell, came to me and said, well, we've still got complaints. And what we did was we sorted, there's about 20 suburbs in Banyule, and we sorted them by the CEFIA code, which is a rank of advantage and disadvantage. So any suburb that has a score of less than 1,000 is disadvantaged, and if it's below 900, they're very disadvantaged. So low socioeconomic, and these three suburbs have a lot of social housing, and you can see that the complaints per 1,000 residents were far highest, and in some cases were up to 10 times higher than some of the higher socioeconomic suburbs. So she implemented a really targeted desexing program. So this was the average of the baseline years. This is impoundments. And you can see she did intensive desexing through these 3 years, and their intake impoundments decreased from 3 cats per 1,000 residents to 1.2, and the euthanasia also decreased. So if you compare that with Yarra Ranges, where their impoundments was still increased by 68% after 3 years, and yet there was a 61% decrease in impoundments here and a 74% decrease in euthanasia, this works better, and it's what the community supports. And complaints, this is the 3 suburbs that have the highest number of complaints, and she implemented this program here, and you can see that the complaints in those 3 suburbs decreased by more than half. Similarly, in Bankstown, RSPCA New South Wales, their shelter here is Yagoona, and that shelter is a big shelter that receives more than 5,500 cats and kittens. 70% are strays. Over 2,000 come from this one city, which is about 350,000 people. But tellingly, 75% were born in the last 6 months. So, it tells us we've got to stop them being born. They'd had a desexing program, a subsidised desexing program, but it wasn't high intensity, it wasn't targeted, and their admissions were constant over the 5 years. So despite a population increase, it had some limited effect in stopping the increase in impoundments, but it wasn't effective in decreasing the number. And they chose Greenacre to be the suburb that they would focus on. It's low socioeconomic, and again, they went for this micro-targeting approach and plotted on a map. The red dots are owner surrenders, all the rest are strays, and you can see that they tend to be located in areas, multiple cats coming in, and they door knocked, dropped flyers, and focused on those areas where they were getting cats into the shelter. And that micro-targeting, they only desex 6.4 cats per 1,000 residents, so 569 cats. And it shows you that in their cause program, people had to have a benefits card, but half of the people, or half of the cats enrolled in this program later didn't have a benefits card. So requiring people to have a benefits card limits the number of people that need to take the opportunity to have their cat desexed. And based on the 4 years preceding, they decreased intake by 31%. The yellow is kittens, and you can see, and the orange is adults, and you can see that the kittens, there was a greater decrease in kittens coming in. And they did a bit of micro-targeting within, it wasn't targeted to individual suburbs, but it was micro-targeted to where cats were coming in, and desexed 1.1 cats, and they got a decrease there by 15%. Compared to the rest of the shelter, where from suburbs outside the Canterbury Bankstown area, it had a 7% increase in cats. And they calculated, based on the number of cats that didn't come into the shelter because of this program, they actually saved $100,000 in sheltering costs. So they had 350 cats less that came in to manage. In our study of the cats that have been desexed with the big advertising program, about 82% of the people consider themselves owners, 18% considered that they were not the owner, but all of them that were feeding one or two cats took ownership, and quite a few of them that were feeding multiple cats took ownership of some or all of the cats. More cats are female, and when we looked at what had kittens, it's these semi-owned cats that are really, 68% of them have already had a litter of kittens, and the most common reason to have kittens was that desexing was too costly. We asked, why have you not already had this cat desexed? What's the single most important factor? 90% said they couldn't afford the desexing costs, and only 4% didn't think it would benefit the cat. So although education needs to be coupled with it, it's not lack of knowledge about the benefits. What people are telling us is that the cost is a barrier. And then we asked, if subsidised desexing and microchipping had been available, what maximum price would you have paid to have this cat desexed and microchipped? 66% said $100 or less, 89% said $200 or less. But as you know, at a private veterinary practice, to desex and microchip a female cat is $300 plus. And I think this is a really important thing. This was a US study where they found that the annual family income was the strongest predictor of whether cats in the household were desexed. And just remember that on average, right across Australia, 1 in 5 households, which is an average of 2.4 people, live on less than $650 a week. And in disadvantaged suburbs, that can be a third of the households. And yet, at $300 plus to desex a cat, a female cat, and people are caring for an average of 1.5 cats, you can see the cost is a huge barrier, and that's why kittens keep being born. So what can you do as animal management officers? Well, stop the kittens. When 70 to 75% were born in the previous 6 months, these targeted free desexing programs, and particularly micro-targeted to where people are feeding multiple cats, is very effective. And then stop the timid and shy cats coming into your pound, because they're going to be difficult to rehome. They're going to be at high risk. They are high risk of complaints and impoundments. And if get those people to adopt them. Those semi-cat owners represent a significant avenue to rehome timid and shy cats. So assist them to adopt, because otherwise you're going to be killing them. And it reduces unnecessary euthanasia and is lower cost. So in summary, remove the barriers. Have free desexing for semi-owners cats, free microchipping, free registration. Do not have mandatory 24/7 containment. Encourage containment and show people how they can do it in a cost-effective way. But remember, in these low socioeconomic areas, a lot of people are in rental properties, housing's not good, and there's a lot of stray cats looking for people to feed them. And many of those cats are poorly socialised, they're timid, they may not be house-trained, but over time they will become socialised. And this is a quote from one of the people who had a cat desexed in our program. Since being desexed, my male cat is a lot calmer. He doesn't attack the children anymore and enjoys just a pat or a cuddle. So they do come around, these cats, over time, and they're best left with the carer and help them be the most responsible cat carers that they can be. And I just wanted to share this with you. It was an email that I got, and it was from Richard. And he said, a little over a year ago, a stray feral kitten came to our home. After we realised it was going to stay, we evaluated our options as far as desexing. Due to the costs involved, we were reluctant to have the operation, as we felt the kitten could run away just as easily as it arrived. We then found out about the cat desexing program and went ahead with this. We were very happy with the service we received. It was very professional. As a side, our little Fifi went in for her female operation, and when we picked her up, we were informed that Fifi was a young man. we decided to keep the name anyway. He has stayed with us and we've built a cat enclosure for him. He's a lovely, very affectionate little cat. The desexing program was great for us. So that's better than taking them in and trying to find a home for them, isn't it? It's much less expensive for you, and it's better for the cat, it's better for the community, it's better for the wildlife. So in conclusion, if your goal is to reduce fighting and soiling and complaints, benefit the environment from less predation, benefit pet and human health, less fighting, less cats, healthy cats and kittens having to be killed by people, reducing complaints and impoundments, and remember, if you're a shelter, it will cost you between $500 and $1,000 to take in a cat, do the healthcare work that it needs, and try and find a home for it. And contracted prices vary quite a bit, but they are generally increasing. And to reduce impact on staff from killing pre-weaned kittens and timid, fearful adults, then get a community cat program. Identify where your suburbs with the highest issues are, the most number of complaints, identify a budget that you've got. Then you find out, you rank your suburbs where you've got enough in your budget to desex. And if you micro target, you may only need to do 10 cats per 1,000 residents, but you do need to blanket that area with that micro targeting. If you can do it based on complaints before they've even come into the shelter, that's most effective. Free desexing the cats in that location, except those that are bred for sale. And in other suburbs, micro target where the kitten's coming from, and manage multi-cat situations by desexing rather than impounding. And just remember, without the community cat programs, someone has to kill the cats and kittens. And killing healthy animals damages people's lives, and in some cases, killing animals kills people too. And the suicide rate for the animal rescue sector, which includes veterinarians in SA, is reached #1 with police and fire. And I like this quote: do the best you can until you know better. Then, when you know better, do better. So let's manage cats scientifically and humanely to decrease cats and costs and impact on people and wildlife. Thanks.
Thank you, Jackie. That was fantastic.
Will I stop the share?
You can do, that's fine. Yes, it's such a complex issue and it's a lot of information to get through in a short time, so I appreciate that. Now, we do have a couple of questions. I don't know if you can see them or not, but Dr. Jess has asked, what about the inclusion of education and legislation? It was my understanding that none of the interventions themselves are sustainable without changes in human behaviour. What is your experience with this?
It's like, we've got so many testimonials from people. It's not legislation. They want to do the right thing. They keep telling us. And I can share with you some of those testimonials. They want to do the right thing. They recognise the risk to wildlife, but they simply can't afford it. Like, you consider living on supporting a family of 2.4 people on less than $650 a week. And a cat has chosen you and you've got compassion. Like, legislation is totally ineffective. And we've got data. We analysed the data from 191,000 cats coming into RSPCA, and we showed that mandated desexing does not work to reduce the kittens coming in. So it's a social problem and it's a human problem. It can only be solved recognising that.
Yeah, recognising the barriers, isn't it? And then helping people to get over and around them.
Yeah, I mean, that data on mandatory containment shows exactly it doesn't work. It doesn't work after 3. You can expect in the first year you have more impoundments, but they're still up after 3 years, and complaints, and they're still up after 20 years. So mandating doesn't help. Education, showing people how they can help, keep cats contained, like that bedtime feeding, which people can afford and is fairly effective, is very effective for DoorDasher cats. So yes, education, but education alone, as you saw, 4% of people didn't realise it was good for the cat, 90% say the barrier is cost.
Right. Yep. Okay. Another question, is this program in partnership with or separate to the National Desexing Network?
Look, we're working with the Animal Welfare League in Queensland, and the National Desexing Network absolutely has a place. And it provides reduced desexing costs, and I know that if people really can't afford it, but it doesn't have the capacity to provide this high intensity targeted program that you need to put a budget into to really target. And it works best when animal management officers are really engaged because they know where the problem areas are. And animal management officers have more, I guess, they're more effective because one of the things, and I know Jenny Cottrell would say that when she went down to someone who was a source of a complaint for the cats, and she'd ask them, is it your cat? And they'd say, no, we're just feeding it. And she'll say, well, under the law, technically it is your cat, and we have two options. So, let me know what you'd like. So I can fine you for having an unregistered cat, and it's not desexed, so it's quite expensive, and you have to register it. Or I can desex it for you free, I'll microchip it for free, and I'll register it for free, and I'll even provide a transport for you. And she only had one person out of all the people she spoke to who said, no, just take the cats, I don't want them. So, you have the most power to get change by putting it to people like that. And so, I honestly believe that animal management officers are the key to the future of stopping this sort of continual killing of the cats and kittens that were born in the last 6 months.
Okay. Another question here from Brad. How did the micro-targeting work with eligibility? Was it certain streets or addresses which made people eligible, or was it more about specific advertising for those areas, but the free desexing was still open for all? ?
The free desexing was only open for people in those target suburbs. And so we'd have a big desexing day every 2 to 4 weeks. And we'd book in about 70 people and hope that 50 to 60 would turn up because that made it cost effective for us. So that was the targeted to the suburb, but then the micro targeting, we went and door knocked. We took those maps and we door knocked all around, and those were where the cats had come from. So that was the person generally who had an issue with the cat and brought it in. And then we door knocked, and within 2 or 3 houses we would find who were feeding cats, and we'd work with those people. So we door knocked up and down the streets, and there's clearly streets that have big problems. And most of the people caring for multi-cat, that are feeding multi-cats, there are mental health issues. They're not coping with life and they need help. But they attach to those cats. If you kill them, they're devastated. And they'll feed more cats. So it's to get in there, get their trust, help them with the transporting. You'll have to trap some of them because although they've got names for them, they talk to them, they may not be able to pick them up.
Okay. And we've had a comment in the chat. We see transport as the second barrier, also fasting for surgery. Any tips on getting help to fast before surgery and transport?
Well, we give people instructions about feeding the cats, but transport is, and we offer transport if they need it. Use volunteers, also used our community liaison officers. And sometime, at Rosewood, we were able to get people to take cats to the community centre because it was only like a kilometre away from most people. So they could take them down there and we could pick them up. Small country towns are likely to be much easier to work with because they're all connected. I think so, yes. Transport barrier. People don't have a car, they can't take. We had one person stuff the cat down his shirt and take it on a train.
My goodness, that is
And
keen.
Yeah, and we were providing containers, like cardboard cat containers, but the problem is the labour in getting them out to people. We will help with trapping, we'll help with catching, and we will help with transport, and that's what Jenny Cottrell found she needed to do too.
Yep. And in terms of the fasting, I mean, there are, I guess, some vets are more worried about the fasting than others, as far as, conversations that I've had. And, they use a tube. There are ways to get around it. Some of the pre-meds also make the cat vomit. So that can help with that problem as well. So that it's really something to chat to your vet about, how to get around those kinds of issues as well, I think.
Yeah, and the cats are coming in early, so they very often haven't been fed, because we needed to come out. The shelter would be doing a deep clean and clean the surgery before these cats came in. And we would be desexing cats from 8:30 to 9 o'clock till about 2 o'clock, and do 50 or 60 cats with 2 vets and a team of fantastic nurses. And then they would all go home that day. We haven't, aspiration has not been an issue. And I know that there's a webinar on, I think at 3 o'clock today, Dr. Maggie McEwen is talking about anaesthetics. So you might want to join that. And Nell, you might be able to send out the webinar details if people are interested.
Who's that with, Jackie?
Vets Beyond Borders is running it.
Oh, okay. If you want to pop the link in the chat. One more question we've got time for. It's 1 minute to 1 o'clock. How many vets were required on the fortnightly desexing clinics, and were they volunteering on those days?
So we had 2 vets, and they were very experienced in high volume, experienced with high volume desexing. So what was the other question? No, one of them was paid to come in to do that, and that's why we had to have 50 cats as a minimum. And Bridget would only fund the desexing to €30 per cat, which is $46.70, I think, in the exchange rate. But if they could do 50 cats in a day, it was profitable. Well, they broke even, and we're very grateful for that. And the other vet was employed and was on the floor, but she wasn't. She was 100% committed to doing that, and they had some very experienced nurses who were very good too.
Right.
We have some procedures for that, and there's, I know that there's a number of vets in Australia who can help with advice on that and anaesthetic protocols as well.
Absolutely. There's a lot of information out there, and if anybody needs anything, feel free to get in touch with us as well, because yes, we can send all that sort of info through. Jenny Cottrell, who was at Banyul and the program Jackie was talking about, has just made a comment. As an AMO, it can be just as much of a challenge to get senior management at council on board to help support the AMOs with these programs, in my experience. And I think that lots of people would agree with you, Jem. All right, we are going to wrap up for today and let Jackie go. She's got always lots of balls in the air and lots to do. So thank you so much for attending, everybody. Thank you so much, Jackie, for the presentation. It was fantastic. Stay tuned to our social media pages and e-news for announcements about future webinars in the series. And if you would like to see a particular presenter or a particular topic presented on, please let us know. We're very open to considering, whatever it is that you guys are interested in. So thanks again, Jackie. I'm sure lots of people will reach out and ask you more questions, more specifics, and take care, everybody. We will see you at the next webinar.
Thanks, everybody.